This patient came to us with significant lower back pain that disrupted both his performance and daily life. He underwent a comprehensive, non-surgical spinal procedure using precision-guided orthobiologics targeting multiple structures in the lumbar region.
Some of the worst problems were the shooting pains down my legs and hips. Standing was an issue. Sitting was the biggest issue. Like if I was at work, fortunately I had one of the desks that raised up so I could stand there and kind of do both of those, and that would help.
So after the procedure, did that improve?
Almost instantly.
So what percentage of pain relief would you say you have now?
I'm going to say 90%. And I know that's more than what's expected.
We like more than expected. Good.
I thank you, because I mean, it's improved my life. So thank you very much.
Treat the spine as an integrated functional unit, not just isolated joints, and this approach delivered a rapid outcome-focused result. Within weeks, he was back to living actively and working without limitations. This is what we aim for at Pain Experts, restoring mobility, preserving strength, and helping our patients avoid surgery quietly, efficiently, and with excellence.